which is a concern for many in the country. The National Hospital Insurance Fund, NHIF, will not cater for extra spouses in a polygamous family setup. In a raft of changes made in the insurer's member management review, a member can only enlist a single spouse as a beneficiary. Enoch starts off tonight's bulletin with the changes and stringent fines NHIF has introduced.
The distinguishing characteristic of the Kenyan healthcare system is its high cost. Kenyans simply pay an arm and a leg for health. Hardly a week goes by without another story in the mainstream or social media of a family somewhere in Kenya dealing with an outrageous medical bill. Yet in more and more cases, these families do not have insurance. Most of them lack reliable sources of income. And so when the national insurer came up with a voluntary membership scheme, it provided a ray of hope to a huge number of needy Kenyan patients. But NHIF's January membership review is likely to cause a public outcry. A memo from the acting NHIF CEO to the insurer's regional and branch managers stipulated what has been termed as punitive measures aimed at curbing defaulters, a move that spells nightmares for Kenyans in the informal sector. The fund has listed a number of revisions for the waiting period to members effective 1st January 2020. Members voluntarily joining the fund will now have to wait for 90 days before they start accessing services or benefits. But there is a caveat. One has to make a 1-year upfront payment within the waiting period. The insurer is not entertaining defaulters. If one makes a late payment, he will incur a fine of 50% of the monthly contribution, coupled with a requirement to pay 1 year in advance. He or she will be restricted against claiming benefits for a period of 30 days. Defaulting for 12 months and above will force one to start payment afresh and can only be eligible for benefits after 90 days upon resumption of payment. A 1-year upfront payment will be applied and strict adherence to deadlines. In a move aimed at stemming defaulters, the National Health Insurance Fund has introduced what is being seen as punitive measures. But even before the review sets in, many Kenyans are up in arms. They say the public insurer has been a letdown to them.
When it comes to the hospitals that you're supposed to go to, you'll get the lowest hospitals, and then in terms of medication that you're supposed to get, you'll get the worst or the bare minimum basic medication, yet you're being deducted.
The Juakali sectors will be the most affected because at some point they can't manage to pay within a month. That means like in normal cases, they are paying maybe after 1 month they pay twice. Sometimes they miss a month, then they pay twice the following month. So in this case, this one will affect them mostly, since they will pay penalty first for defaulting, not paying in time.
But what has left George baffled is the new restriction on beneficiaries for national scheme members. According to the NHIF memo, the number of dependents has been limited to a maximum of 1 spouse and 5 children.
To me, it is unfortunate that it has come out. This is a memo that has come in the new year.
Enoch, Citizen TV, Nairobi.